health is really important to discuss with women, not only in the post-menopause, but throughout life, because osteoporosis and more importantly, falls with osteoporosis. A woman who is in her 80s, for example, who has a fall and breaks a hip, has an 80 over 80% chance of dying from that. So prevention occurs before she falls and breaks her hip. Prevention occurs and conversations occur with women in their 20s and 30s about diet and making sure that they are consuming uh, enough calcium. And in the menopause and in the menopausal transition, it's important to say, stay strong, right? Stay strong. Your lean body mass matters. Your strength matters. Your coordination matters. Your engagement and remaining engaged with the world really does matter, because while bone density is going to decrease as we get older, the rate of that decrease can be, which is to some degree genetically predetermined. That rate of increase, however, can be influenced by how we live our lives, right? How we how we exercise, how we stay strong, how we stay engaged in the world, how we live our lives. Bone health is the one area that you can absolutely speak with patients about hormone replacement and hormone therapy, because for patients who are at high risk, they really should consider, are my risks high enough for osteoporosis that I might consider using hormones specifically to ameliorate or diminish that risk, right? So I think that bone health is one of the things that I hope people are talking about before uh, their last or their final menstrual period. But if that's the first time you have the conversation, that conversation should include a discussion about staying strong, maintaining your lean body mass, um, maintaining, understanding what your family history is, being screened, right? Getting a DEXA scan when it is appropriate, right? Based on risk factors, and really understanding that 20, 30 years ahead of the fracture is when we need to be thinking about